So if you have ever experienced heel pain, you are not alone. The most common cause is a condition called plantar fasciitis. In our HealthCast today, we're going to look at a new and minimally invasive procedure that can offer a lot of much needed relief. In his job with a local contractor, 55-year-old John Kennedy is on his feet all day.
Back and forth with the warehouse, carrying items and everything, and also at home working out, constantly on my feet.
Then one day, he started having severe pain in his left foot.
Every time I'd get out of bed in the middle of the night, it was excruciating pain.
Dr. Michael DeCack with Cleveland Clinic Weston says John had a severe case of plantar fasciitis.
Plantar fasciitis oftentimes is pain along the medial part or the inside part of the heel. And typically it's worse with the first few steps in the morning, and as the day goes on, it tends to get a little bit better, and then by the very end of the day, patients are not wanting to stand on their feet because of the pain.
Risk factors include a decrease in mobility of the ankle or a tightness in the calf muscle. The arch of your feet, either too high or too flat, can also increase the risk of developing fasciitis. And being overweight can put more stress on that area of the foot.
Millions of Americans are affected every year from this, and up to 10% of the population at any point in their life can be affected from this condition.
When cortisone injections and immobilization failed to give John relief, and he didn't want to undergo invasive surgery, Dr. DeCack offered a newer and less aggressive ultrasound-guided option.
So the procedure that we're talking about is a percutaneous fasciotomy or fasciectomy, which involves that tiny little incision, so small no stitches are needed, and it's done all under local anesthesia, meaning the patient's entirely awake for the duration of the procedure.
After a couple of weeks of recovery and physical therapy, John is now comfortably back on his feet.
I'd say I'm back to probably 95% easily pain-free.
Good for him. All right, well, success rates for this particular procedure are very similar to more invasive surgery, and it can also be used in some cases for shoulder pain as well.